It has been 1 year since the World Health Organization declared COVID-19 a worldwide pandemic on March 11th, 2020. On the same date, in Greater Sudbury, Public Health Sudbury and Districts held a press conference announcing the first case of COVID-19 in the area.
This is a man in his 50s on whom we're continuing to do additional investigations to really understand what the risks are. At this point in time, we do know that he attended PDAC 2020, the conference in Toronto, and then returned to Sudbury.
Also, on March 11th, Laurentian University announced the cancellation of all its classes. Studies would be done online until further notice.
The person concerned in Sudbury has a connection to the Laurentian University campus.
Just days before students were to begin their March break, the Ontario government ordered all publicly funded schools and daycares to shut down for 3 weeks, extending the March break to April 6. As more testing was being done at Health Sciences North, the hospital set up Sudbury's first COVID-19 assessment center on Walford Road. On March 17th, Ontario declared a state of emergency. It was also on that day that the first COVID-related death was reported in the province.
We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19.
Non-essential travel across the Canada-U.S. border was restricted, and the province ordered non-essential businesses to close for 14 days. Immediately, this meant that all bars and restaurants were shut down, as well as indoor gyms, local attractions, libraries, many retail stores, hair salons, and movie theaters. Grocery stores saw lengthy lineups amid fears of a worsening crisis. With some sought-after products sold out at many stores, the province urged consumers to practice normal buying habits and avoid panic buying and stockpiling items like hand sanitizer, masks, and even toilet paper. On March 23rd, Premier Doug Ford announced that students across the province would not be returning to school on April 6th, as the province first hoped. With the closure of schools and daycares, parents who were lucky enough to be able to work from home did so, while trying to keep their children busy and assisting them with online classes. On April 2nd, Public Health Sudbury reported the first COVID-related death in the city, a man in his 70s who contracted the virus through international travel. On April 6, Sudbury declared a state of emergency. By May 1st, the Sudbury Health District had a total of 58 confirmed cases of COVID-19. Despite the low case numbers back then, outbreaks were occurring in nursing and retirement homes across the province. Non-essential visits were suspended, and long-term care residents were isolated from friends and family members. With personal protective equipment in short supply, Sudbury businesses stepped up and donated any extra Lysol wipes, latex gloves, or N95 masks they had to the hospital.
I just want to thank everybody who donated. I can't believe how many people really want to take part and help.
Distilleries started to produce hand sanitizer, and seamstresses were making cloth masks and gowns for long-term care homes. Messages of hope were not only being spread across Sudbury, but internationally as well. Communities across the globe recognized the frontline workers, applauding them for their efforts in the fight against COVID-19. Much like the rest of the world, Sudburyans got creative and came up with ways to celebrate birthdays while remaining safely apart.
'Cause for the first time,
the community continued to support and uplift one another through times of uncertainty and isolation.
I hope you enjoyed the show.
And as the summer of 2020 approached, things were looking promising. On June 12th, Northern Ontario entered Stage 2 of the province's reopening plan, allowing many businesses to open their doors for the first time in nearly 3 months. A bit of normalcy had returned to our daily lives. In August, new case numbers continued to decline across Ontario, repeatedly coming in under 100 new cases per day. These were the lowest daily numbers the province had seen in months. During the week of September 8th, many students were excited to return to in-class learning, while others chose to continue their learning online from home. But it was the calm before the storm. As Thanksgiving approached, Ontarians were encouraged to only celebrate with people from their own households. Premier Doug Ford cautioned against sending kids out trick-or-treating as COVID cases were on the rise. The same went for Christmas holidays. In December, the province started to see more than 2,000 new cases each day. And on Boxing Day, the entire province had been shut down for the second time. All Ontario students participated in online learning during the first week of the new year. While schools and daycares in Northern Ontario reopened for in-class learning on January 11th, the province remained in lockdown. Restrictions varied between regions. In Sudbury, residents were still able to enjoy winter activities as long as COVID-19 protocols were followed. Meanwhile, an outbreak at Amberwood Suites Retirement Home saw 46 confirmed cases of COVID-19 from January to February. Sadly, 7 of the residents died in relation to the outbreak. On February 5th, the first COVID-19 UK variant was confirmed in Greater Sudbury, and by February 9th, 2 more confirmed cases of the variant were reported locally. On February 11th, the Ontario government announced the postponement of March break to April 12th.
Postponing March break, not canceling it, is an important way that schools can help to limit community transmission. We recognize that congregation is a key driver of the spread of COVID-19, something we realized over the winter break, and we will not take that risk again with your child, with our staff, with Ontario families.
After nearly 2 months, the shutdown order was lifted in the Public Health Sudbury and districts on February 16th, and the region moved into the orange restrict level of the province's COVID-19 response framework. This meant indoor dining, clothing stores, gyms, and cinemas were allowed to reopen with limited capacities. But the second provincial lockdown took a toll on small businesses. The Ford government faced criticism for allowing big box stores to remain open during the shutdown, while moving small businesses to online or curbside sales only. During the week of February 22nd, voluntary asymptomatic testing began in schools in the Sudbury and District Health Region. On February 24th, Ontario rolled out its COVID-19 vaccine program with plans of numerous mass vaccination sites at hockey arenas and community centres across the province. In Sudbury, staff and essential caregivers at long-term care homes lined up outside the Carmichael Arena to receive their first dose of the vaccine. Staff at Health Sciences North also had the opportunity to receive the vaccine. On February 25th, an outbreak was declared at Balmoral Apartments on Bruce Avenue. Public Health Sudbury and Districts posted a letter in the lobby of the 17-story high-rise asking that all tenants and staff who work in the building stay home. Another notice, posted by Public Health, informed tenants that COVID-19 testing would be offered on site on February 28th. Meanwhile, cases in Sudbury area schools were increasing. During the final week of February, numerous classes at several different schools were dismissed after confirmed cases of COVID-19 were reported. The recent spike in school-related cases also affected bus routes. Students, staff, and bus drivers deemed as close contacts were told to self-isolate and get tested.
In your nose, little tickle tickle.
By the first week of March, the demand for COVID-19 testing in Sudbury was so high, Health Sciences North increased staffing and expanded its hours. The hospital said daily requests for testing more than tripled during the week of March 1st due to outbreaks declared at local schools. According to information listed on the 4 school boards' websites, on March 7th, there were 42 active cases of COVID-19 in 17 schools in the Sudbury area. 8 schools were closed, 7 declared as active outbreaks. On March 8th, 2021, Sudbury moved into the red control zone, but it was short-lived. Exactly 1 year after the COVID-19 pandemic was declared, Sudbury and districts received news that the region would be heading into the gray lockdown zone as of March 12th. This third lockdown was implemented after the region's case rate drastically increased by 54.1% between March 3rd and the 9th. Public Health Sudbury and Districts also announced that all schools in the area would close and move to online learning as of March 15th. Now, 1 year after the pandemic was declared, the battle against COVID-19 continues. By the end of the day on March 14th, 2021, Public Health Sudbury and Districts reported 291 active cases of COVID-19, bringing the total number of cases in the area to 1,011. There have been 3 confirmed cases of the UK variant, and 15 deaths have been reported in the area.